6-year-old man and complaining of shortness of breath. ये आपको कब से हो रहा है ये सांस की तकलीफ?
1 month से 1 month 2 months हो रहा सर.
2 महीने से आपको पता चला है. कैसे पता चला?
ये थोड़ा ये चलता है तो सांस आ रही सर.
चलने में सांस आ रही है. So what you can see is that there is a left ventricular hypertrophy here, and there is something in the septum which kind of is a sigmoid septum. While sigmoid septums are normal, one can also think of a dyskinetic septum here, in this area particularly. So whether there has been an injury due to coronary artery disease is not very clear, but yeah, HOCM would be slightly more hypertrophy. The most important thing in HOCM or HCM is hypertrophy. Now there is some hypertrophy, but not of that magnitude as to even think of HCM. Of course, he has got metabolic syndrome in the sense that he has got some truncal obesity, and his age is 56. So one would expect certain changes in the heart at this time of his life, and what we are thinking is we are trying to see whether he's got HFPF or not. Now if you see the aortic root here and the LA here, and you compare it with the LA and the aortic root of just this previous echo of the 20-year-old boy, there the LA was slightly bigger, and this LA is almost the same size as the aortic root, which is normal. So the LA is still okay, means there hasn't been enough LV-EDP to increase the size, but the LV hypertrophy is kind of suggestive that his shortness of breath could be related to an early heart failure with preserved ejection fraction. Ejection fraction is preserved, as you can see, so it's quite okay. It's around 60%. In fact, he has gotten it done elsewhere, either he or somebody else, I can't remember. आपने पहले ये कराया है ना टेस्ट ये वाला?
जी कराया सर.
हाँ, right. So, but then they did not mention all these points. So that's why I had to take another look and take the video most important. Okay, so let's see. Aorta. 3 valve cus in the aorta. And there is a rib coming in between, so it's difficult to see it properly. More or less these are the things, and one can always do a E by A ratio to see whether there is any pointers towards a diastolic dysfunction. No, this looks to be fairly okay. Okay, all right, fine.